Welcome back to Torn. In the last video, we broke down what the ACL is and made it very simple to understand. However, what's a little bit more difficult to recognize is when an ACL tear occurs and how it occurs. So in this video, we're going to break that down. We're going to talk about how an ACL tear occurs, in what situations it occurs, and make it simple for you to understand and recognize when these injuries happen. First, we want to make the distinction that generally ACL injuries fall into two different categories: contact injuries and non-contact injuries. Contact injuries, as the name implies, is when there is actually a direct blow to the knee. So, for example, in football, when you see a helmet to the knee or when there's a pileup and someone falls on the knee, that is a contact injury. On the other hand, you have non-contact injuries. So a non-contact injury is when there's indirect contact or no contact at all that causes an ACL tear. So as we'll describe in this video, deceleration events, landing events, change of direction events can all cause an ACL tear. In the literature, we see that non-contact injuries, much to the surprise of people, actually make up about 70% of all ACL injuries. Before we look at some of the scenarios in which ACL tears occur, I want to make the distinction that not every ACL tear is identical. And certainly there are different movements that athletes make that cause ACL tears. However, we can look at certain movement patterns that are common amongst all of those injuries. We'll start with non-contact injuries because they're the most common. So in this image, this is a very frequently observed mechanism or position in which the ACL tear occurs during these non-contact injuries. So let's use this image as a baseline. So when we look at some of these injuries in a second of deceleration events, change of direction, landing mechanics, some of these injuries that cause ACL tears, this image that you're looking at here, there's a lot of commonalities that this image shows that you can translate into when we look at some of these videos in a second. So let's use this as a baseline going forward. That way we have a better understanding of some of the common movement patterns that can cause these injuries. So let's break this frequently observed mechanism of injury down for an ACL. So specifically, let's start right at the hip. So look what's going on at the hip in the image. You see that that hip is abducted or moving away from midline. As we move down the leg, look kind of what's going on at the foot. You see that that foot is slightly out or externally rotated, and obviously it's planted in the image. If you move up the chain and look at more of the torso, you can see that that trunk is leaning toward the side of the injury. So that left leg is the side that's being injured. That trunk is leaning toward that side. If you see a little bit what's going on at the torso or the chest, you can see a slight rotation away from that left side that's going on at the torso as well. The combination of all of these things can preclude the knee, as you see that knee valgus, what we call it, that knee from abducting as well or coming in. So the combination of all of these things is what we consider to be a frequently observed mechanism of injury for an ACL tear or more of a non-contact ACL tear. So let's get into some practical or real-world injuries that we see amongst professional athletes that occur in these different movement patterns. So specifically, I want to break down three different mechanisms or three different scenarios in which we would see ACL tears occur. The first one being a deceleration event. So the way we'll describe a deceleration event is when an athlete goes from some sort of speed and requires them to stop completely or stop and change directions. So that's how we would describe deceleration. So in our case, we have Micah Parsons. So in this video, Micah Parsons is getting around a defender and having to adjust to the movement of the quarterback. So as you can see in this video, and very common to the image that we just described, and I'll put those images up side by side, there are a lot of commonalities between these two. So you see that Micah Parsons' abducted hip, you can see his externally rotated or foot that's slightly outside of baseline, right? You can see a little bit of that trunk lean to his left side. Micah Parsons in this image is injuring his left knee. So you can see that trunk leaning to the left. There is a very subtle rotation of the trunk away from that side, but as you can see, there's an ever so slight movement of the knee abducted or falling in, and that's what we describe as dynamic valgus. So as you can see, it's not just one movement that causes that ACL tear to occur. It's a combination of movements. So the combination of what's going on at the torso, the hips, the knees, the foot is what inevitably and eventually causes Micah Parsons to tear his ACL. So the next scenario we will describe is a change of direction or cutting event. So Jamison Williams for Alabama, this is a very well-known injury, or medical professionals like to describe this injury very prototypically, but this is a very common mechanism of injury for an ACL tear to occur, especially in non-contact injury. So very similarly to the image that we discussed earlier as a common mechanism for an ACL tear to occur, you can see what's going on with Jamison Williams during this position. So obviously he's cutting left to right. There's a defender in front of him that's causing him to react. And obviously for him, he's cutting back inside of the field. But you can see a lot of the same similarities that you see in that image. And we'll pull that image up now so we can see kind of a side-by-side frame. Obviously his hip, if you look at that first, is abducted or moving away from his midline. You can see that his foot is obviously planted. It's a little bit externally rotated or outside of baseline. You can see what's going on at the trunk. He has that nice lean to that left side, and then a little bit of that rotation about the trunk as well, all causing kind of that dynamic valgus or the knee to fall in. And it's right when you see that knee fall in that's when you see in this image him going down or the ACL tear occurring. So this video does a very good job of describing the common mechanism for an ACL injury. So we see what's going on at multiple levels of the body. I also want to make the disclaimer that although this athlete is making this movement, this isn't automatically going to predispose someone to tearing every single time this movement is made. Obviously, there are other factors that we will discuss maybe in other videos as risk factors to why someone tears and someone doesn't. But just because someone goes into this specific movement pattern does not automatically mean they're going to tear their ACL every time. So the last example of a scenario in which an ACL tear can occur is a landing event. So you see this in basketball, you see this in volleyball, you see this in any sport where there's a lot of high impact, high force, high load, high jumping ability, and landing ability. So basketball in particular, the one we want to describe in this situation is Derrick Rose. So this is an ACL tear occurring in which we don't see that prototypical movement pattern that we discussed in the last two. It's slightly different, and that's why I brought it up here, because I want to explain that a little bit further. And this just goes to show that there are a multitude of positions that you can land, whether it's single leg like we discussed in the last two, or in Derrick Rose's case where he's landing on a double leg and he still tears the ACL. There's a lot of different situations in which this can occur, and I want to expose that so we have an understanding of that it's not just one position or another. So the scenario in which Derrick Rose tears his ACL is slightly different as we described. In this situation, he's coming off some sort of jump stop position where whether he's going to pass it off, whether he's going to shoot, regardless, he's landing on 2 feet. You see a lot of stress placed on the front of the knee when he lands. He's not landing very softly, and this may predispose his ACL injury as well. So in this situation, as he lands, you see a little bit of a stiff landing, but you also see his left knee falling in. The combination of those high forces, a little bit more of a stiff landing, and then that tertiary abduction or valgus of the knee, that's when you see that ACL tear occurring. So jump stop, high amount of force coming down, ground reaction force going into the floor. We have a little bit more of a stiff knee as a landing position as opposed to a really soft landing. Along with that, you see the knee kind of abducting or falling in, as we describe as the dynamic valgus. The combination of all those things, including the speed at which he's doing this, because Derrick Rose is a very twitchy and fast player. The combination of all of those things in this situation is what inevitably causes that ACL tear to occur. So these are a few of the scenarios in which we see, as we discussed, the deceleration events, the change of direction or cutting events, and then that landing event that we just described. These are what we consider to be the prototypical non-contact scenarios in which we generally see ACL tears occur. As the research describes, this can be anywhere from 70 to 80% of all ACL injuries come from non-contact injuries. So in the last video, we talked about what the ACL is. In this video, we talked a little bit more about how it's torn and some of the scenarios in which you would see these ACL injuries occurring. In the next video, I want to talk about who is at risk for an ACL tear. So subscribe to the channel, hit that notification button, and we'll catch you guys in the next video.